Okay, let's move on, and I'd like to introduce my good friend, Sanjang J. Lin from National Taiwan University, Taipei, and the topic of his talk will be two distinct spontaneous regenerative activities to repair ionizing radiation-induced dystrophy in anagen follicles. Derek.
Thank you for the kind introduction. Jerry from Taiwan University, and Dr. Rompalis in his video he showed that how to kill single cells in the hair follicle with femtosecond laser. And in this talk, I'll talk about the response of hair follicle to radiation injury that is often encountered in cancer patients. I have no financial conflict of interest, and you can see here as a dermatologist, we often see patients undergoing cancer treatment, including chemotherapy and radiation therapy. Radiation therapy can induce permanent as well as transient hair loss, and there's no efficient method to prevent hair loss, and also there's a lack of detailed description of response of anagen hair follicle to radiation. And this is the review from Rockpost. Rockpost has done a lot in chemotherapy. The response of hair follicle to chemotherapy, you can see here, basically there are two response pathways. First is the dystrophic anagen. Hair follicles shrink a little bit and in resume the anagen. The other response is dystrophic catagen pathway, and hair follicle go into catagen directly after radiation injury. And also, Dr. Boschkarev told us that the hair follicle dystrophy due to chemotherapy is p53 dependent, but we don't know nothing about we don't know nothing about how hair follicle respond to radiation injury. So basically our question is we want to categorize how hair follicle respond to ionizing radiation injury, and also is there any way to prevent hair loss from it? You can see here we irradiated mice in early anagen, and there's a dose response of hair loss. At 2 grade there is no hair loss, but at 5 grade and 7.5 grade there is severe hair loss. We check the histology. This is the 7.5 grade. Anagen go directly into catagen, so this is trophic catagen. But when we look at 2 grade and 5 grade, there are two distinct morphology change. The 2 grade, you can see here, hair follicle, hair bulb shrink a little bit, but they resume the anagen morphology about after 48 to 72 hours. And at 5 grade, it's very interesting that you can see here, hair follicle shrink a lot. It's about shrink to about 1/3 of its initial length, then it recover at about 120 hours to day 7. You can see here. So then in both conditions, they enter catagen on day 10. So after this, because the energy is not prolonged, so we think this is not a new energy. So we call it a type 2 dystrophic anagen response because there is a disappearance of a normal hair bulb structure. Then the next question is that how the hair follicle repair themselves. You can see here, this is the cell apoptosis. The green is the 5 grade. This is more and prolonged and extensive hair follicle cell apoptosis in the hair bulb induced at 5 grade. And then we analyze the cell proliferation. You can see here, at 6 hours, the hair follicle cell proliferation is stopped. Then they resume cell proliferation at 12 hours. And this one, the blue line here, you can see here, the cell proliferation at a 2 grade is replacing the cells. So the hair follicle resumes anagen. There is no much hair loss. But at 5 grade, you can see here, this is the cell proliferation here. But this is very extensive cell apoptosis before 72 hours. So this attempt failed. Then after 72 hours, there is another wave of cell proliferation. And this second wave of cell proliferation successfully recovered the hair follicle structure. So there are 2 attempts. The first is before 48 hours. The second is after 72 hours. Then we ask, in the early regenerative time, what's the cell origin? And when you look at a hair bulb, we see a K5 cell is usually only positive at the basal layer. But during early regenerative time, we found that there is a increase of K5 positive cell here. You can see in 2 grade and 5 grade, there's increase of K5 positive cells. Then it comes down. So it suggests that the basal hair bulb cell may be involved in repairing the hair bulb. So the possible cell origin that we think is like this: after radiation injury, the basal hair bulb cells they come up, proliferate, and replenish the dying cell in the germinating center. And so we do a lineage tracing. You can see here after radiation, the basal bulb cells is labeled with red fluorescence after 12 to 36 hours. The basal cells, they come up and replenish the lost cell and to recover the hair bulb structure. In the unirradiated condition, they stay in the basal or only to the suprabasal layer. And we also found that in the early repair, we don't really continue to BRD labeling, or told say we don't really detect any proliferation of bulge stem cells. And also we didn't trace the bulge stem cell with K19-3 TD tomato. They stay above there. So there's not much, there's no contribution of bulge stem cell to the early repair. Then we ask, this is the early repair. So who is responsible for the late repair? Now you can see here the hair shrink to this structure, dystrophic epithelial strand. Then from this strand, the second regenerative attempt starts. So we found that the lower tip cells in the epithelial strand, they are positive for epithelium. And at about 48 to 96 hours, the lower tip cells, they proliferate first to recover the initial regenerated hair bulb structure. And here you can see bulge stem cells. They do not proliferate until 122 hours. So this is a stepwise cell activation for late regenerative attempt. First by the lower tip cells, then by bulge stem cells. We also lineage trace the cells. We found that we are able to label lineage trace the lower segment cells with LGR5 TD tomato. So you can see here we label the cell bulges here. We label these cells, and these cells during the late repair they come down and contribute to the hair bulb structure and also the concentric layers of cells in the regenerated hair bulb. And we also found that the bulge stem cell, they did not proliferate before day 5. And on day 6, we can see that they come down, but only contribute to the outer root sheaths. So there's a complementary contribution of different cell population during the late regenerative repair. Then we look at the signaling part. We found many signaling is disrupted or altered during the process, but today I'll talk about the Wnt signaling. You can see here the left one is inhibited and then is activated. So this is the qPCR. After radiation at 5 grade, it is downregulated and then is recovered. You can see here when the late regenerative time is started, you can see the appearance of left one. And also when there are many Wnt ligands are downregulated by radiation, and here you can see the Wnt3A, it appeared in the epithelial strand before the recovery of left ones. So it indicates that Wnt ligands, the reappearance of Wnt ligand may help to repair or help to restart the regenerative attempt. Then we ask whether Wnt signaling is required for late regenerative attempt. We inhibit Wnt ligand secretion and Wnt signaling by pharmacological inhibition. You can see this is a control. The late regeneration is inhibited when we inhibit Wnt signaling. And also, if we knock out beta-catenin activity in the epithelium, there's no late regeneration, and hair follicles enter catagen directly. Then we check the P53. You can see here at 2 grade, this is 5 grade. At 5 grade, P53 is expressed and is induced to a higher level and more prolonged than the 2 grade. And when P53 is knocked out, there is no hair dystrophy and no hair loss, and also there is no cell apoptosis. Then we ask how to antagonize the effect of P53. Because at the high degree of injury, Wnt signaling is almost stopped. So we think that maybe if we maintain the Wnt signaling in the early regenerative step, we can reduce the hair loss. So we deliver locally with Wnt3A coated beads, and you can see here after radiation, the Wnt3A treated group, the hair loss is reduced. This is bovine serum control, and this is a ventral view. And also we found that the Wnt3A treatment, it only slightly reduced cell apoptosis, but it significantly increased cell proliferation in the hair bulb. So this enhanced regenerative attempt or cell proliferation help to recover or help to replenish the dying cells in the hair bulb. So in summary, we found that there are two in the dystrophic anagen pathway by radiation. There are two regenerative attempts. First, at a low level of injury, they use the local basal bulb cells to restore the hair bulb structure, and there is only a very slight hair loss. And they regenerate attempts because the first attempt failed. Then it's initiated after 72 hours. And there are different cell populations that contributing to the late regenerative attempt. So I would like to thank the funding agent and also our collaborators, especially Max and also Yao Zhong and Tim. And also we also thank our Ross and George and also Hero for their very helpful suggestion during our work. And this is the work is performed by my student Adam Huang. This is Adam. Thank you.
So that's great. We'll have questions. In the meantime, I have to make 2 quick announcements. One is that there's a satellite symposium right after this that you need a ticket for. If you don't have a ticket, you can wait in line, and after 15 minutes, they'll let you in if there's space. The other is that this is the last day to view the exhibits. I guess they don't work on weekends, so if you haven't been to the exhibits, now's the time. So, questions?
I have a question to Dr. Lim. In your model, you used only one single irradiation, right?
Yes.
You check what happens if you repeat irradiations, like in men that more resembles irradiations to humans.
You mean repeat?
Repeat irradiations, repeat stimulus for the dystrophic phenotypes that you see with the hair follicle.
Yeah, we didn't repeat. We just give the mouse one shot of radiation. We didn't really repeat the radiation. So.
I'm involved in oncology and in chemotherapy. Do you see your product, your research down the road as producing a product that would come on the market for patients getting, chemotherapy and radiation, that somehow there would be a product on the market down the road to help these patients?
We also work on chemotherapy, but I didn't show it here. I think we think that the response are quite similar. Chemotherapy and radiation therapy. So, but Today I only show the radiation, the response to radiation.
And do you see some down the road, possibly a product being on the market to help these patients?
On the market,
On the market to actually help the patients?
I don't think there are no efficient methods to reduce hair loss on the market.
Do you see your research producing that down the road?
We hope so.
So do we.
All right, I want to thank the speakers and thank you all for saying one. Thanks again.